My name is Jack Fletcher. I'm originally from Glasgow and I've studied at Dundee for almost 5 years now. I'm currently studying an MSc for Product Design.
My name is Gloria and I am from California and I am studying a Master's in Design for Healthcare. Our Master's project is we're in conjunction with the NHS Scotland in the Realistic Medicine department there. And so the public awareness campaign that we're doing is really trying to figure out different ways of engagement to the public to really let them know that they're allowed to ask questions of their doctor and help with making choices.
Yeah, so with the public awareness campaign, it's really targeting towards the patients themselves, and this will be done through physical and digital components. So in terms of the physical side, it'll be more like posters, and you decide the kind of perfect place for these to be placed for the attention, and the digital side through GIFs, small short clip videos to really catch the attention on social media platforms, things like that. I think we definitely work well as a team together as well. So I kind of come from more of a design background, whereas I didn't really have much healthcare insight before I started this. Gloria has had that in the past. So I think both of us together really kind of hone in our skills and bring them together for hopefully a good public awareness campaign in the end. The inspiration, I'd say, kind of comes from a lot of the online sources. So again, a lot of the things we're creating is kind of illustrative side to things, the design. So we really want to catch the user's eye, so the patient's eye, sorry. So we kind of look at different online sources, different illustration websites.
In doing the research, that's where I find a lot of it, is I find some of these keywords like drivers have changed. I go, oh, let's do this, let's put the patient in the driver's seat. And that it's patient-centered care. So then I start thinking, how can we put the patient in the center? So a lot of my inspiration comes from doing the research and finding those keywords that just might catch your attention. We have such variety in the modules. We get to work on real-life projects. So we worked with the Eden project that's coming to Dundee. And that was really exciting that you're being a small part of this, doing that. Figuring out those small places where you're making a little difference, and they are real life projects.
In terms of where I want to head afterwards, I really like the whole workshops. That's something I've really enjoyed doing, and Gloria and myself have had a couple of workshops we've been able to conduct through this placement, and that's been really great fun, and it's something that really gets everyone involved and people learn from it. They don't really understand what's going on with the shared decision making, and they leave with more insights, and you're left with more feedback from them as well. So I think something in that kind of route maybe.
I really am intrigued with these underpinnings of all the behind the scenes education and how to make these programs better. And with the Eden Project Dundee, we were introduced to the realistic medicine concept back in the autumn. And I was like, wow, this is really interesting because it's not something that I've noticed happening in the United States. And so I'd really like to bring more of these concepts back, and probably with some big healthcare centers or something like that, to see if I can continue doing some public health education and just making some changes for the better.